Hello and welcome to the GooCampus podcast. And we here are bringing in, the expert insights and real life experiences to guide international medical graduates, the IMGs, on their journey of a medical career in the UK. And I'm your host today, Santosh Shekhar, CEO of GooCampus. And today we have two incredible guests who have successfully navigated the UK medical pathway and, are able to get into the NHS system. Joining us today is Dr. Athresh K Narayanamurthy and Dr. Vishal Kalmani. Dr. Athresh, if you could introduce yourself a little bit.
Hello, I am Dr. Athresh K Narayanamurthy. I am currently working as IMT2 in Leeds Teaching Hospital.
And Dr. Vishal,
Yeah. Hi, I'm Dr. Vishal M. Kalmani, and I'm an FY2 equivalent or Trusted Doctor in Barking, Havering, and Redbridge NHS Trust
nice,
in the emergency department.
great. So today in this episode, we will be discussing about the PLAB or the UKMLA preparation or securing an NHS job, career progression, and adapting to the life in the UK. If you're an IMG and looking for the guidance to get into the UK medical career pathway, and I think this podcast would definitely be valuable. And all of you are listening out there, just check this out. And we would like to start off with a couple of questions that could address both of y'all. So, could you briefly share your journey from India, getting into the UK? How has it been when you started off into the NHS? Dr. Athresh, we can start with you.
So I'm currently working in IMT2 in Leeds Teaching Hospital. It all started, I completed my internship in 2019 from JJM Medical College, Davangere. After that, I started working in accident and emergency department in Vasavi hospitals in Bangalore. It was during this time I started my preparation and my career towards the UK program in order to get the UK license. I started off with my English test, and then I had a huge gap for my PLAB exams during the COVID time. However, I managed successfully to complete the PLAB 2 exam in October 2021, and I got full GMC registration with license to practice in December 2021. I did try to get a clinical attachment, but it was the Omicron wave and there was restrictions of footfall in the hospital. So I did not get my attachment, but I managed to secure a job in as a trust grade SHO in trauma and orthopedics in Northern Lincolnshire and Gould NHS Trust. It was during this time when I was working as a trust grade SHO in orthopedics, I realized that it is medicine is what I'm looking for. My passion is more towards the medicine specialities. I utilized this opportunity as a trust grade while I was working as a trust grade doctor to build my portfolio. I did a couple of audits in NHS. I did a national level poster presentation. I did some local teachings. And I built some points. I did some locums in ED and SDEC. It's called FEMD Emergency Care Center. All of this helped me to develop good skills in the field of medicine specialties, and I applied for my training. I got a decent rank, and I started IMT in August 2023, and now I'm in IMT Year 2 in Leeds Teaching Hospital Trust.
Great, great. And then that's a wonderful journey that you've had from the entire pathway.
Thank you.
So, Dr. Vishal, how about you?
Yeah. I started off my journey, I would say, in 2020 itself during the time of COVID, because that was when most of us were free, and that is when I thought of researching about the whole UK pathway and what to do and how to do and when to do. So all of that started and began during my, I was in my third year during the COVID wave. So that's when I started. But during my internship is when I was seriously focusing on it, and I graduated in the year 2022. So that was in 2022, I gave my English exam as well. Post that, in 2023, I gave my PLAB 1 because the wait list was huge due to the COVID pandemic. The number of people who were waiting to give the exam were high, so I had to wait a whole year. So I was, in the meanwhile, I thought of utilizing that time to work and build my communication and then patient interaction. So I knew that this is going to play a major role if I have to step into the UK pathway. So I was working in an A&E department in Manipal Hospitals, Bangalore. Post that, I did give my PLAB 1, and then in 2022 and 2023 and 2024 beginning is where I gave my PLAB 2.
Okay.
And by April of 2024, I had my GMC with full registration. And after that, yeah, in the meanwhile, I did manage to get two clinical attachments as well. One of it was in Liverpool University Hospitals, and the other one was in Pinderfields Hospital in Wakefield.
Oh, okay.
During this time, well, I realized the importance of audits, and I did get an opportunity to work on two audits also in the Department of Trauma and Orthopedics. And yeah, since I said that I've started, my prep towards UK in 2020, I had the opportunity to participate in several international conferences as well and present a few paper and poster presentations under my belt. So that actually helped me build my portfolio. And at the end of all of this journey, so April is when I got registered, and then I got my offer for my first job in the month of October. So it took me exactly 6 months.
Okay.
These days, getting a job, like everybody knows how it is, but
Difficult,
yeah,
yes.
it did happen. Yes. So yeah, I got my offer in October, and then I've started recently in this month of Jan. I've started my work in
Great.
Barking, Havering, and Redbridge in ED. So ED, well, I'll have to be rotating in resus, majors, and estate, like Dr. Athresh mentioned, same day emergency care. So this is where I'm currently at.
Great. Thank you, Doctor. Thank you. So, during the journey, the transition from India to the UK, what was like the major challenge during this transition for getting into the medical pathway for the UK, or a specific challenge, and how did you all overcome it? I think Dr. Vishal, you can continue like that, so we can finish it up. So
Okay.
you can answer that. Major challenge and how did you overcome it?
Okay. Well, I would tell the major challenge that I had to face was the phase between my PLAB2 results or my registration to getting a job. That phase was the most challenging because, with it used to literally be like every day I wake up to see one or the other mails saying you were unsuccessful. We're really sorry to inform you that you were unsuccessful. So that became like a routine. And every day waking up to see those mails, it
Absolutely.
really, messes your head to another level, to be honest. So when that was going on, so see, I had to try and keep my focus on what my goal is. Irrespective of how many ever rejections I get, I knew that one or the other day I will succeed. So I just had to wait for that. And eventually, yes, so that did happen. So you asked me how I overcame it. I would say it is just perseverance.
Mhm.
That would be my answer. Yeah.
And Dr. Athresh, during your time, how was it? What was the challenge?
My time, one of the biggest challenges I can say is I can declare myself as a COVID batch for PLAB. So my biggest challenge was the time after my English exam, getting my PLAB 1 and PLAB 2. It lasted almost for 2 years. I did not know how long this is going to take. I did not know when my exam's going to be. I had booked PLAB 1 twice and it had cancelled twice. I did not know how long this journey is going to be. And there were times where I was totally demotivated and I went off the track. I was distracted. I thought, okay, I would look for alternate career pathways like pursuing MD in India or trying for NEET exam and everything. However, it was during this time I met GooCampus, where I got into contact with some of the doctors who had already been with GooCampus and had recently secured their first job in the UK. I spoke to them on phone through GooCampus contact. This one way motivated me to work hard for a brighter future. And the other one was I had a couple of friends who were also in the same boat as me. They helped me to realize it's not just me being in that phase. The entire world is in a standstill. So we need to focus now, not lose hope now. So we will be there someday. And the second difficulty was after the PLAB 2, getting the first job. In the UK, securing the first job is very difficult. Once you get your first job, then it is a more smoother journey. I did not get my attachment because of the Omicron wave. All the HRs were instructed to reduce the number of footfall in the hospital. And second thing is my visa was getting expiring. I had to come back to India. And staying in the UK for so long is also very expensive. It's not everyone can afford. After so many rejections and hundreds of applications, I got a couple of interviews. I did get this job, my first job in my second interview. And the moment I got my first job, I cancelled the interview which was due, because instead of me, someone else can take up the job, because anyway I'm not going to take up the job. I can say these are some of the difficulties I faced, and long wait for exams, and are some of the difficulties which everyone faces during this journey. The only solution is patience, persistence, and keep yourself motivated. There's no other option.
Yeah, I think in all scenarios it is about how long we have the patience, or you wait for either
Yeah.
it first it used to be waiting for a PLAB one slot, and now it is waiting for a job. So everywhere the common scenario would be having persistence and patience to get through that phase of
Yes.
getting the positive mail or call from the NHS.
Yeah.
Um, so, for summing up the first part of the questions, I would say that if you like to start over again, what is that one step that you could have tried to do different? Anything in mind that you feel that if you had started again, if you had to start today again, anything different that you would have done?
If I had to start this process again with the same amount of time, and if I had a clear decision as to what specialty I want to get into, there are a couple of things I would have done actually. I would have prepped myself for the membership exams like MRCP or MRCS, whatever. So this way, this builds my portfolio a bit stronger, and I know my goal. What's the end point? In what career I need to choose? What training pathway I need to get into? And this will also give a good confidence and help me to give better care for patients. And this also increase the chances of securing your first job. Second thing is I would have spent some time in doing some online diploma or masters in the subject of my interest, because this can be done online. This can be done at my own pace, and this also adds some points to the portfolio. And also it looks good on my CV and helps me to secure more job, a training job later. And third thing, I would have got PG cert, teaching degree, or teaching diploma. In this way, I can secure more points. I can be a better teacher. This will help me to progress better in NHS career. And also, I would have tried to utilize to get more contacts with the UK doctors to see what is expected now, how is the bottleneck competition, and what I can do from India while I'm waiting for the exams to get my first job and other things to happen, and see how I can be ahead of others. These are some of the things I can think of.
Thank you, Doctor. Doctor Vishal, any inputs on that?
Well, most of it, I would say it is very much similar. But one thing that I would tell is when I was working in Manipal hospitals for 1 year, I was also given the option, and I was told by my HOD in the department back then that since you're anyways going to be here for a year, because I had my PLAB one lined up, so my HOD told me that why don't you just do a 1 year degree, which is a fellowship in emergency medicine. At that point, I was someone who used to think when I am going to the UK, why would this matter? Because at that point, I never knew that that one degree also would make so much of a difference, and I neglected it, to be honest, at that point, and I did not do it. But if I had done it, so like Dr. Athresh, likewise, even I got this job in my second interview. In my first interview, I was asked, one of the question was, now, do you have any other degree? And at that point is when I regretted not doing that degree. So at that very moment during the interview is when I felt, oh, okay, so I should have taken up that opportunity and finished that fellowship in emergency medicine. That would have given me a very big boost, and probably I would have gotten my first job in the first interview itself. But so that is something that I would have changed. I would have completed that degree in order to give me a better chance of getting my first job. I would have done that different. Yeah.
Thank you, Doctor. Thank you. Dr. Athresh, Dr. Vishal, this question is for you.
Okay.
So basically, how is the introduction of UKMLA changed the pathway for IMGs? Is there something that the new doctor should be prepared of, where previously to PLAB 2 or PLAB 1 in the UKMLA process? Anything different?
So I would say, see, everything has its own pros and cons, but in this introduction, I personally would consider that it has more pros because see, before when it was PLAB, only the IMGs used to write it, and the UK graduates directly would enter into the training program, so they had their life sorted. They did not have to worry like us, where we had to give exams, get a license, and then sit and apply for non-training jobs and then go to training. But their life was much more easier. But after UKMLA has been introduced, I feel that it gives a fair chance on merit for either the IMGs and the UK graduates, where people who deserve it, they can, they have a better chance of getting into the system earlier. So I would say that it is much more easier for the IMGs if they are, if they actually deserve it, and if they genuinely have worked for it, then I feel that they have a better chance of getting into the system.
Okay. Okay. And Doctor, what kind of strategies or resources you used or you feel is useful for your PLAB 1 exams and PLAB 2 exams?
So yeah, during my PLAB 1 exam, to be honest, I was completely blank about how to prepare and stuff. So that's where GooCampus helped me throughout the process. And they recommended that I use PLAB keys and PLABable for my PLAB 1 preparation. And that actually did help me a lot. And I did get to know how the structure of the exam is going to be, and that helped me clear my PLAB 1 in my first go. And then when it came to PLAB 2 again, before I even came to the UK, how I should prepare or what I should focus on, everything was detailed in beforehand, and I had a rough idea. Okay, so this is how the exam is going to be, and this is how I should prepare. So I had my own plan that would help me in preparing for my PLAB 2, and then post that for PLAB 2, I used Aspire's course. Again, that was recommended by GooCampus itself. And I, during my time here, I actually did compare most of the other resources as well, like Moshobi or other, academies that do similar training. But then I found Aspire to be much more helpful because, in a way that the scenarios that they have in their coaching, it is very much similar to the one in the exam. So you have an idea on how the exam is actually going to be, and you'll be much more confident during the exam after you finish a few stations among your 16 to 18 stations. Once you finish a few stations, you'll know that, okay, this is everything that I've prepared for. So that gives you very good confidence during your exam. So yeah, these were my resources, and that's how I happened to clear both my exams.
Any points you would like to add, Dr. Athresh, on it? Anything from your,
No, no, I would say I would continue the same. PLAB one case, PLABable, and same get some guidance from the academy. And the main key here would be everyone will give all the information. It is you, how much you practice, how much efforts you put in. Whatever resources you have, it's only 30%. Rest 70% is your hard work, your dedication, and your time, what you give to it. And all the people say it is difficult. I do agree it is difficult, but it's not impossible. When so many of us do it, that means everyone can do it. Sometimes some people will not be able to do it in their first attempt. And that is the point where they should not give up, because the GMC gives you four chances at least. So you need to utilize it, and there's a very good chance that you will be able to do it next attempt. So you need to make use of the opportunity, and it's okay. It's okay even if you're not able, you're not successful in your first attempt. It's still okay, because everyone's situation is not the same. Everyone will be in a different timeline. Everyone will have different personal circumstances, different financial circumstances, different skills and knowledge. So it's okay to take multiple chances, but they should not stop working towards it. That would be my only suggestion.
Okay. Thank you, Doctor. Thank you. So, when coming to the PLAB 2 exams, what are the common mistakes that generally the IMGs do in the PLAB 2, the OSCEs, the common mistakes, and how important is clinical communication for the PLAB 2 exams? Dr. Vishal, you can answer that.
Okay. So back home, in India, we do not give much importance on addressing how the patient is feeling at that point. All we are ever worried is on what the patient has come with, or how effectively we are treating the patient. That is all is our concern. But in the UK, even though you're not able to treat the patient optimally, it is how you talk to them, or how comfortable you make them feel during that consultation. Because in each scenario during the exam, we have 8 minutes to talk to the patient. What I have noticed is, it is not if you're able to come to a diagnosis, or it is not if you're able to give a management plan. It is if you're being a good doctor, and if you're being a safe doctor. So that is not really practiced in India, is what I feel. or it is not really given importance as much, like in the UK. So in India, it is only about if you know your subject, but here it is about subject is next, but how you treat the patient and how safe you are towards the patient is what is more important. So understanding that and focusing on our communication and showing empathy when it's necessary or showing sympathy, irrespective of what. But when it is needed, we have to do it. We have to put ourselves in the patient's shoe and analyze. That is when we can do that. So I would suggest everyone should practice more on their communication, and that would really help in their PLAB too.
It's a very key aspect for clearing the PLAB 2 exams. I think Dr. Athresh, you've been seeing a lot of patients, I'm sure by now. So,
Yeah.
what? So, how has it been for you as an experience?
So the main lessons I learned and main experience I learned and which is useful even for the exam is first thing is good communication. Second thing is having a holistic approach towards the patient. In the UK, when you're treating a patient, you're not treating only the medical problem. You also need to consider the social circumstances, family circumstances. You need to treat the lifestyle changes they need to make. You need to treat overall like a holistic approach. And also, one thing I learned is it's not giving care is also means not just giving the care, it also knowing when to stop the care. Most of the patients will have advanced directories. Most of the elderly patients they live independently, so you need to look what additional support they need. You need to know what amount of care you need to give and what kind of care gives them more pain than the recovery. For example, when somebody is elderly, leaving them with symptomatic management would be more beneficial because even with invasive treatment, you will not be able to reverse whatever has happened instead you're giving more pain. So you need to know when to stop the right care, and you need to involve. You need to have good communication. You need to involve the family members. You need to involve next of kin. It's overall a holistic approach, which is one thing I like, and everything is patient centric care.
Mm,
Whatever you do is you think of patient, their next of kin, you see how the patient feels, you ask the patient. They have the rights to refuse a treatment. You need to ask, you need to give them the options. They can choose with the options. They can't demand the treatment, but they can still choose to accept or refuse the treatment you are giving, and they will have their own reasons. And when you ask them, most of the time they are right. They know what they want, and they know what their body wants, and they know what they can ignore. So I think the holistic approach is what differentiates from rest of the healthcare in the world.
yeah. Thank you, Doctor. Thank you for those wonderful insights. Dr. Athresh, this question is for you. So, what challenges do IMGs typically face when they are doing a job hunting in the UK, and how could they actually stand out during their application process?
I think, as everybody knows, the most greatest challenge everybody has now is securing their first job.
Mhm.
Um, what I feel is, from my perspective, nowadays, every job application you go, there is essential criteria and desirable criteria. I think almost all the doctors have essential criteria, and I think we must start focusing on desirable criteria, and also some of the things like membership exams, masters or diploma in the specialty, and teaching PG cert. These are some of the things which most commonly people won't have, and you need at least 6 months to a year to develop, get certified for complete these diplomas and degrees. So people should start working on desirable criteria and these extra additional points, and also. Instead of looking only for junior doctor job, people should also look for clinical fellow jobs, and also they should look for teaching clinical posts where there is 60% to 70% of university teaching and 20 to 30% of working as a doctor. This will help them to get into the NHS, build their portfolio, and then since they already would have at least 6 months to a year of experience, then they can easily get the next level job or get into training directly. Both the options will be available. And also, even if you have everything, we don't know how the algorithm of track jobs works. We don't know how the HR filters the application when they have hundreds of applications and only one or two jobs. I would say it's just your luck of having your application at the right time in the right place. The only way is you need to wait patiently for your time to come. That's all.
Okay. Okay. So, ideally, doctors have to spend quite a lot of time to do all this before even they start applying for the job, so that all these, like how you said, desirable criterias are fulfilled, uh, uh, so that the chances are higher for probably getting selected or doing a better job in the interview, to get selected.
Yes, because all of this PG cert teaching, masters or diploma, everything is online. You can do it even from India at your own pace. You can do it any wherever you are. You can do it at your own pace, and also it will help you develop good skills and build a stronger foundation for you. So even though it might look expensive or it might look too much burden at this level, but eventually in a few years, all of this will come into use, and these degrees which you obtain is also going to help you not just at the ST1 training level, even at the specialty training level, these are going to help you.
Correct, correct. I think that's what we've also been advising, and because essentially many of the doctors have this perception that, okay, yeah, I finished my PLAB 2, PLAB 1 is done, PLAB 2 is done, I can just start applying for jobs. But then I know
Yeah.
it's a competitive world there now, and considering the situation, I think we need to adapt and do more things, so that we are there in that race, to make sure that we are highlighted, or our application is highlighted whenever the HR is selecting the job, based, like how you say, sometimes if luck is a factor, uh,
Yes.
to be ready for it.
Yes.
And what specialities, or which specialities or roles are more IMG friendly, and which ones are more highly competitive, Doctor Athresh?
Yeah. This is one of the question I get asked by so many people, like some of my med school friends and my juniors also. I would say there is nothing called IMG friendly specialty because everything is an open application and everyone can apply. The criteria is open. If you qualify, you are in. If you don't qualify, you're not shortlisted. And once you qualify in the interview, it's your skill, your own skill. You have to prove in the interview. So there's nothing like IMG friendly. However, when you talk about competition, I generally feel from the recent data of the previous years and whatever changes they have made to get into the training, surgical branches are usually generally more competitive in the sense they demand a lot in your portfolio. And also, there's a time frame. You cannot be over experienced and apply for a junior level job for a core surgical training. After a couple of years of experience, you are automatically disqualified to apply for a core surgical job. They expect you to apply for a ST3 level job. So surgical branches are more demanding in terms of portfolio and requirements. If somebody is in their final year or in their internship, they can, if they are interested in surgical branch, this will be the right opportunity for them to look into the portfolio of the surgical specialties to application requirements and start working on it. And it can easily be easily achieved after that.
Okay. Okay. And Doctor, what are the key differences between a trust grade and training position in the NHS, and how IMGs can secure training positions?
I would say training job is a structured career pathway to get a CCT or to become a consultant eventually after a few years of training in the UK.
Okay.
Trust grade job is like a locally employed job within one particular trust or hospital where you'll have to work in one department or a couple of departments based on your job description. And you will work as a fixed role like an FY2 or SHO or CT1. It is more recommended to get a trust grade job, get NHS experience, see what branch of specialty you like, develop the skills, get better contacts, learn tips and tricks from your seniors, from the registrars or consultants, because they have also gone through all of this. They will explain you and they will explain you in such a way that you will get a clear picture how to build your portfolio. Because everyone says build your portfolio, but when you look at the opportunities, even though there are opportunities, you will not know how to utilize that opportunity. When you get proper guidance from your seniors or colleagues, you will be able to build your portfolio and get into training job easily. And it will improve the chances of you getting into training easily.
Okay. Thank you, Doctor. And you've gone through that journey of being a junior doctor and going into IMT2. So, what is that journey been for you for that specific position from a junior doctor to IMT2, and what are the factors contributed in that growth for you, Doctor?
It was a difficult journey because I started with a surgical specialty in UK and I had to take a U-turn and enter the medical specialty. So the first question I was asked in my training interview was why are you working in orthopedics and why do you want to get into medicine? So I was very clear. I told them I took up this job to in order to get UK visa, in order to get NHS experience, in order to understand how NHS works, in order to get do a couple of audits, to do some presentations in the NHS, and also use do some locums in medicine specialties. And also, I was not sure if I wanted to go into medicine or surgery. I was more inclined towards medicine, but I still wanted to explore this option. So I was very open and I was very honest about it. And they accepted it. They accepted it because rest of my portfolio was towards medicine. And I think in order to get shortlisted for IMT, the first requirement is having enough number of points. Once you have enough number of points in your portfolio, you get shortlisted for interview. And once you get the slot for interview, you can prepare yourself. That's where you need to show your clinical skills, ethical skills, communication, and your portfolio. Although it does not give a direct advantage, they would still give you a good advantage in interest in specialty. So I would say these are some of the things which helped me to get into training. And I would say it's not a race to become a consultant in UK. All our med school we have been told that our MBBS is of no value. You need to become a consultant. You need to start doing PG everything. It's not a race in UK. Everyone is happy doing a post MBBS job. They're happy with their life. You get a decent pay to look after yourself and your family. You can think what you want in your life, because once you start what you want, once you enter the specialty, you're going to do it till you retire.
Okay.
So it's okay. If not today, you can do it tomorrow. It's okay. So you need to take it slow and have patience.
Yeah, I think that is well said. Because generally, doctors, when they start the pathway, it's either for them, yes, how fast I could get into a job and how fast would I become a consultant, or how fast I would get into the specialty or get into a training job. So in a summary, would you suggest doctors should be picky about their jobs when they enter the UK pathway or the system in the NHS, or should they wait for the right job, or they can just first, like how you said, get into the experience or get into the system? Would you summarize it that should they be picky or not picky of their jobs?
It really depends. If you are starting at a post MBBS level, if you are building your portfolio with respect to PG cert, teaching courses and everything, you need not be picky. But if you have a clear decision, you want a particular specialty, and if you have already given membership exams, then you need to be picky. Because you will look really stupid if you have an MRCP exam and you're applying for a urology job. So this here comes the balance. If you are open to opportunities, the best thing is do a broad courses like teaching courses, leadership courses, communications courses. Do these things. Get a training, get a job in the UK. Then you also can get something called a staging period in UK. Which you can get permission from your hospital. You can work in different departments of your choice for up to 2 weeks. See if that specialty suits you, or see if that kind of lifestyle, if that those skills you can match those skills, or see if you are able to learn those skills in future. See if you can dedicate yourself in that particular field, and then you can still choose. So I would recommend overall, if you're starting at a post MBBS level, don't be picky. Get into NHS, get the valuable experience, and then get into training job, because how department works in India is very different to how department works in UK.
Thank you, doctor. Thank you. And just one last question related to work. So basically, when doctors are applying for jobs in the track, I'm sure when you've done it too, do you actually recommend to have different kind of write-ups, or changing the CV, or applying it for different jobs or different positions? And because sometimes doctors apply for a lot of positions, but unknowingly whether they're eligible to be in that position or not, or it could be underqualified or overqualified. So what do you recommend, that they need to read through and then change the way they apply for each job, or just with the same application then apply for all jobs?
I know it's very difficult because each doctor will be applying for hundreds of jobs. It's very difficult for to go through every job application. But however, imagine if you are lucky on one particular day and your application is on the top list and your HR views your application, and if the job description is totally contradicting to your application or your what you expect from that job, you would straight away be rejected. There's also you hardly get few chances to be on top of the list or to be for someone to see your CV, and we cannot predict which one of your job application will be in that situation. So, although even I know it's very difficult, but it's still better to read the application and read the job description and prepare your CV in a way to suit that job or express your desire or what you are expecting from that job or what you want to become. Because sometimes some of the jobs offer clinical teaching in university along with SHO job, like a 60-40 or a 50-50 ratio. But nowhere in your CV, some of the doctors will mention about teaching experience or interest in teaching. So in those of the situations, you will lose some points.
So yeah, doctor. So I think that's a probably we had a good discussion, or got good insights about how to apply for jobs, or what are the chances, and what should they actually do, the new doctors that aspiring to get into the UK. Coming to work-life balance and cultural adaptation in the UK. So how does the work-life balance for doctors in the UK be compared to India? Like, I know you mentioned some few points previously about treating patients, but in terms of work life balance, how different is it, Dr. Vishal could start off with it.
Okay. So to be honest, the work-life balance when compared to India is actually very good because, okay, so if I were to compare myself with someone doing their post-graduation first year in India, so they would straight up have about
Yes,
36
yeah.
hours of duty and then followed by 12 hours of rest and then come back again, do 36 hours. So that is how the work culture in India is. And when that is compared to UK, there is not a single shift where you do 36 hours. The maximum you would ever do is probably 12 and a half hours in your nights, or maximum about 13 hours because of the handover and if it was a very busy night. That's it. But apart from that, again, what we do, I mean, most of the jobs, as far as I've seen when I was applying, as well as in my current job as well, it is only 40 hours a week. And if we do even work extra also, it is about 48 to 50 hours a week, but not beyond that. And that is like a typical job anywhere in the world. And we have a lot of time for for ourselves as well. And also, like I previously mentioned about the 40 hours, so beyond 40 hours, whatever you work, you will still be paid for it. And that is a pretty good deal, to be honest, when compared to India, where you're just made to work, but you get nothing in return. So here in the UK, you're working less, you have your personal time as well. You can do things that you desire and your hobbies you can explore. And along with that, you're getting a good pay. So any day, I would tell that the work-life balance in the UK is much more better when compared to India.
And so when you say about how can you say the IMGs be better prepared for the cultural and ethical difference that is there in the UK in the healthcare system, because it is quite evident there is a lot of difference in the way they function. So what is the difference, Dr. Athresh? You could express that.
So yes, UK is multicultural. You see patients from different ethnicity, different religions, and all age groups of people, all age groups of patients. You see, and you also work with different people. You work from people from who has a different, who are from different countries and everything. I would say. Every hospital, most of the trust, they have something called IMG communities. You can join the IMG community where they'll help you to get induced well in the trust. And also most of the consultants and most of the staff are very friendly to you. And if you're really struggling with something, you need to ask for help. You need to speak to your colleagues or you need to ask your supervisor. I've not seen a single consultant or a single senior colleague of mine refusing to help me. In fact, everyone is more helpful because everyone is worried only about our personal health as well as the patient safety. So I would say I would encourage people to be more social, to interact with more colleagues, interact with more seniors and more consultants. and also engage in activities like doctor. If there are activities from the doctor's mess, you can take part. You meet new people. You meet different people. You will learn different things. Your communications will improve. Your understanding of living in UK will improve, and you can also join if there is any local your council cultural events. You can go there. You can pay a visit. This will open your mind, and you need to. This will open your mind, and you'll be in a better position. You will not feel homesick, or you will not feel left out.
Okay, thank you, doctor. And what advice do you have for doctors who struggle with their, kind of adapting to the NHS environment, on, suddenly seeing this cultural difference, or, like how you said, communication skills, or, treating the patients or talking to the patients differently. How do they really adapt? And what would you suggest? A few points that, that they could use to uh, do it better once they come to the UK.
I did struggle initially when I came to NHS in my first day of my job. But then most of the trust, 99% of the trust, offer something called shadowing period. So you get 4 to 6 weeks of shadowing, where you can observe already doctors who are working in the trust. You can learn from them. So, and this will help you build interactions. This will help you develop confidence. And when you're shadowing another doctor, you still can go with the doctor for procedures, for patient consultations, and everything. This will indirectly help you to in your communication skills. This will also improve communicating with the patients as well as the rest of the staff. That is one thing. Second thing, I would say involve in more outdoor activities. Join Facebook groups, especially there are many Indian community Facebook groups. There are this BAPIO, BMA. Involved in BMA meetings. You can go to some of the events of BAPIO, and you can. I did go for doctors' mess events. So we used to have social meetings or payday social events in the doctors' mess, and I had good number of friends in the UK from my med school. So traveling is another thing. You can explore outdoor activities and traveling where you meet local people, you speak, you interact with them every day. In this way, you feel more confident, and you can develop your communication skills. And I would say the first thing most of the people feel homesick would be due to lack of proper food which they used to eat back home. So once you start to cook or find a good source of water food you prefer, half of your loneliness, half of your homesickness is gone. And then your mind will be open, you'll be happy, and then you can explore everything else. This is just from my personal experience.
What do you want to say, Dr. Vishal? Do you feel homesick after going to the UK?
Um, to be honest, not really. Actually, yeah, like Dr. Athresh did mention, socializing and keeping yourself busy is what will help you, not have such thoughts of homesickness or missing home. And the other part that he already did touch is about food. So, I mean, make it a hobby and then try different cuisines, try different types of food that you prepare. And it's okay. I mean, you might not get it right the first time, and you might still start feeling, how's food was better, and you might start missing the food that you used to get back at home. But eventually, without you realizing, you will become someone capable of, sustaining any place at any given point. So that is, a great plus, because you never know when you'll have to stay where or what type of community you have around you. So the more you start adapting to people, so basically you do not restrict yourself or do not put a boundary around yourself. Be open to people and converse well and socialize. Nobody in yeah, like Dr. Athresh did mention, everyone is friendly in the trust, be it your colleagues, your seniors, everyone. So the minute you open up to them and see, basically in the NHS, the major thing is seeking help. If you do not ask for help, nobody will come to you and offer help. So the minute you ask for it, everyone is willing to help you. So just tell them whatever you're feeling. Even if you are feeling homesick, just go to them, and there are several support groups as well. Um, Especially for IMGs, because they all most of the trusts do have it, and they also understand the difficulties and challenges that the IMGs face. So the minute we go and approach them for help, they are always there, and they will get us in touch with people who are similarly, new to the system, and how they adapted and their experiences. When they talk to us about all of this, we can probably try and inculcate some of those into our daily routine, and that will help us overcome all these challenges in the beginning phases, I'd say.
Correct. Okay. Thank you, doctor. And now coming to a very important topic of future of IMGs and the NHS hiring going on in the UK. So, is the NHS job market becoming more competitive for IMGs, or do you see any emerging trends in hiring that's going to happen in the UK, or saturation point of jobs, or what is it? What would you like to comment on this, Dr. Thresh?
I would say when you take statistical evidence, there are more doctors waiting, applying for a particular job. There are less number of job posts. It is very evident the competition is very high, saturation is very high. But so is the same with other countries. When you look at India's population, number of doctors, number of hospitals available, the same competition. In fact, there's more competition in India. When you look at USA, USMLE, there is more competition in USA. When you look at Australia, there are a lot of British doctors who go to Australia. Now there are a lot of Indian doctors who go to Australia. I think New Zealand is also very competitive. It is the same everywhere. It is the same everywhere. So, and it is not really in our control. We cannot do anything about it. Only thing we can do is build up our portfolio, build up your application. Once you build your application, you have good portfolio, you have a good CV, you have good skill set. If not UK, you can easily get into Australia also. So I would say you need to continue to work on your career, and it will be difficult. All of us have been through, and even for us also, even in future to apply to specialty training, it is still difficult. But we need to continue to work on it, and we can overcome it. If it is difficult for me, it will be difficult for rest thousands of doctors also. And there's nothing I can do about it, or nothing any of the doctors can do about it. So instead, we can focus on what we can do in building in our portfolio and in our career. That's all.
Okay. So, do you suggest that, when, okay, if a doctor in India who's, say, probably for any given reason that is not able to do his PG in India and is focused or for either going into the UK market, saying that I want to become a doctor in the UK, it could be either fascination of getting into the internet, settling down in the UK or getting into the NHS system, or for not getting the right specialty in India. So they take a decision, I want to go to the UK. But do you suggest doctors, though it is a competitive time, saturation time, to have a plan B, because they could still, try doing the pathway, getting into a PLAB 1, finishing the PLAB 2, like how you said, build portfolio and do their membership exams, and then, keeping themselves ready, and then they can still work in India till they probably get an opportunity in the UK. Would you suggest that kind of a plan of action for doctors in India for the IMGs?
I would still recommend that. Now there are more number of opportunities because, as you can see, GooCampus itself provides multiple dual training opportunities. There is medicine training in India as well as UK, and and the advantage in applying for a UK training or preparing for UK is UK degree is accepted worldwide. So once you get into training UK, and once you have a proper training and you are certified, you can go everywhere. You can go to Middle East. You go back to India. You can go to Australia. You can go to New Zealand. You can go to Canada. You can go to Singapore. You can go to Malaysia. UK degree is more valuable than most other countries. And second thing is, you might find it difficult at this point of time. But when you look into longer picture, when your career is 40 years, 2 years of waiting is not going to make any changes for rest 38 years or next 45 years. These 2 3 years might be stressful, but it is still fruitful at the end. Once you are into it, you are more secured, and you can enjoy the rest of your life. So I would still recommend people try what they want.
Okay. And still have that key aspect is the patience. Wait for it. Wait for the right time. Okay. I would like to ask you a question about the immigration policies, or will affect the career opportunities? Would that be something that you could answer on? Do you think would there be any changes in the immigration policies that could affect career opportunities for IMGs?
So there are some recent changes in immigration policies, generally for students and rest of the population. For doctors, they have increased the overall fees of the visa applications to the UK, which is one thing which affects the doctors. And second thing is, the good thing is, doctors are still in the shortage occupation list in the UK. And we do not know when this can be changed and when this will change. And it's nothing in our control. And no one can influence the government in making taking sudden decisions with respect to immigration. But if they make sudden decisions, it's not affecting you. It's affecting thousands of doctors. And I don't think so. Any country would want to move thousands of doctors away from their healthcare all of a sudden. If they do any changes, they will do in a phase-wise manner, and we'll have enough time to look at other options.
Plan B. Okay. Thank you, Doctor. I think for Doctor Vishal, it would be too early to comment on it, but
No worries. Yeah.
okay. So, kind of final takeaways, I would say. So, what is one piece of advice you wish someone had given you before moving to the UK as an IMG? One piece of advice, Doctor Athresh.
One piece of advice I wish someone had given to me was utilize my time I spent during my PLAB exams, like 2 years of time, to focus on portfolio and other activities like a diploma degree or a master's in a particular specialty. Uh, I did not get any of that advice at that point of time. I wish I had got that. Then I would have been in a much better position in terms of my CV and other portfolio.
Okay.
And otherwise, I got rest of the time I got a very good advice from rest of the doctors, especially the UK working doctors. Everyone told it's okay, just wait. It's okay, just wait. You will be there, and it eventually happened.
Dr. Vishal, you any?
Um, if I were to get one advice that would, change the course of my UK journey, I would just say, you know, probably much similar to Dr. Athresh, because I did not know the importance or the value of building a good portfolio. I always used to actually consider it lightly, even though, yes, GooCampus did push me to build my CV as well. I did do most of it. Not gonna say no, but I could have, done a few things on my own as well. There is no end to our portfolio basically. So whatever you do is never going to go for a waste. It is always something that will stay with you till the end of your life. So none of the degrees you do, none of the courses you do, none of the conferences you attend, nothing is of waste. So keep updating yourself every single day. Think what you can do better. Think ahead. See, for example, during the phase of job hunting, it took a lot of stress in my life as well during job hunting. So for people who are preparing themselves for job hunting and stuff, I would just say think of this as an opportunity. Do not sit and waste your time by just sitting and applying. Think of why you might not be shortlisted, and think of how you can be better, or think of what else you can add to your portfolio that will give you a higher chance of getting shortlisted for interviews. So just keep working, and the more you have on your CV, obviously the chances are better. So this I think would probably be one of the best advice.
Yeah, I think well said, Doctor. Because as a company that we keep, pushing our doctors, saying that do more portfolio activities, or whatever portfolio activities has been given, take it on a very serious note. And because end of the day, you need to know what you've done in that part, because whenever you're asked in an interview, you should be very confident to answer that whatever you've done, those portfolio activities. And plus, there are a lot of times when you said that the final statement that when you're preparing for your when you're waiting for a job, a lot of doctors wait just by only applying, but they would not want to spend that same time to do something additional. So they only, I know India is a lot of, it is a lot of peer pressure, family pressure. It could become marriage pressure. You've not got a job. A lot of pressure in India. It's like a pressure cooker, I would say. So because of that, but we keep advising doctors, whatever pressure is said and done, you need to keep looking for alternative things till you get your first job. Otherwise, what happens, stress gets into your mind, and then you would want to back out. You feel that, oh, let me try back in India, and you put in a lot of effort. So I think, yeah, that is well said. They should keep trying even when they've not got the jobs, so that you can update your CV regularly.
Yeah. At one point, even, Dr. Athresh did mention that these days we should focus on desirable criteria because most of them have essential. But as far as I have noticed, these days people even have essential as well as desirable. So that is how the competition these days is. So we should try and think, what more can we do? What more can I put on my CV? And that is where I think people should, start focusing more on.
So yeah, so Doctor, so almost we're there in the final phase of this podcast. So to sum it up, if you had to sum up the key success for IMGs in one sentence, what would it be, Doctor Athresh?
I would say the key success for IMGs in the UK is staying patient, continuously building your portfolio, continuously building your skill set, and utilizing every opportunities that comes to you.
Okay, thank you, Dr. Vishal. Any inputs from your end?
If I had to tell in one sentence, yes, patience, perseverance, persistence, and along with that, just put in the hard yards and eventually see. It might be difficult, but it is not impossible. So eventually you will end up with it. So just keep trying, and yes, it will be fruitful.
Thank you, Doctor. So I think the conversations that we've had or the discussions that we have, I think it would give a lot of picture or a lot of insights to the doctors who are going to watch this video, and we are happy that you shared a lot of your experience, personal experience, and Dr. Athresh has been there for some time, and you've just got into the system. I'm sure you're going to do well, and we wish you that you keep growing and become consultants soon at your own pace and your specialty. So good luck, and yeah, I think thank you for this wonderful time.
Thank you.
Thank you, and all the best to everyone pursuing and planning on getting to the UK.
That's it, guys. So this is the end of the GooCampus podcast, and that was an incredibly insightful discussion that we've had. A huge thank you to Dr. Athresh and Dr. Vishal for sharing their journey, practical tips, advice, and inspiring IMGs what to do and what not to do, and when to do it, and in the right way. So to all our listeners, we hope that this episode has given you a clear understanding of the UK medical career pathway and the realities of working in the NHS. That's what we wanted to share with this video, that how is it actually real there when you get into the UK system. And GooCampus is here always to support you all whenever you all need us. And this is Santosh Shekhar signing off from GooCampus. Thank you.